Welcome, everybody. Thanks for joining us on our weekly update on the coronavirus pandemic. I'm Rich Fitzgerald, County Executive, joined by Health Department Director Dr. Deborah Bogan. Over the last week, we have seen our numbers here in Allegheny County and throughout southwestern Pennsylvania remain relatively good. Over the last week, we've seen 187 new cases, and that compares to 184 cases the 7 days prior to that. The governor last week and the State Department of Health put out some guidance that they would like to see to beginning to open things up a little bit. 50 cases per 100,000 population over a 14-day period. For Allegheny County, that would be approximately 625 over a 14-day period. And as we're at 371, obviously we're under that. So we want to make sure that we continue to do the mitigation practices that everybody has been doing at the recommendation of our health officials, the distancing, the physical distancing, wearing the masks, all those type of things. We also, in the last 7 days, reports 12 deaths. And again, that's we want to reach out and offer our condolences to the families of those 12 individuals who passed away over the last week. We also had 24 hospitalizations of people who were hospitalized over that period of time up through today. The governor and the state has come up with a few more openings that have occurred over the last week. The announcement that golf courses will be open, again, with a lot of mitigation, and that's the case in just about every single activity that we go with. Marinas are going to be open, campgrounds, car showrooms, and within the limited way, real estate as well. So again, all of these things that are going to occur are going to occur with the guidance of the Department of State Health Department. We want to continue to do that. We're also working with our surrounding counties because we are in an 11-county Southwest region. And I won't go through all the counties. They all know which ones they are, but reaching out to our various county commissioners and officials throughout the southwestern Pennsylvania region, we're all in this together. We know people cross county lines for recreation, people cross county lines for work, education, et cetera. So we want to make sure we continue to work together, continue to collaborate. And I really appreciate the fact that has certainly happened among elected officials, as well as business and as well as our health experts and our service providers. So what do we expect coming up over the next couple of weeks? Well, the governor has indicated that there's going to be some opening of our economy. And again, we've mentioned some of those that are already happening. And I think you're probably going to see some regions of the state that have been defined that have really done very, very well. And we'll take a look over the next couple of weeks what I think that'll happen. But we've got to continue that. It really is based on those numbers. If we continue to keep our numbers of positive tests low and the mitigation and everything that we've done to date, I think we'll continue and probably see some more opening up over the next few weeks. But we want to make sure that we continue to use those rules. One thing I do want to say, though, as we do open up, I want to make sure that people that are going out are wearing their masks. We are getting reports of some folks, they wear them into the workplace and not always taking them off or not always keeping them on through, in coming in close contact with people. So we want to make sure people continue to do that because, as Dr. Levine said, that mask is really to protect everybody else as much as it is to protect the individual that's wearing them. We're going to continue to advocate for some of the resources and relief we get from the state and federal level. Our partners at all levels have been very, very good, and I appreciate that work that our congressional delegation has done at the federal level, that our state leaders have done, from Governor Wolf and his administration to our state senators, state representatives have been very, very helpful and doing well along those lines. We mentioned last week about, while people are in, that we want to continue to get the census. People answer that. How we do on the census and how many people get counted will really impact the amount of funding that we get for the things that we're looking for right now, whether it's PPEs, mitigation, health, education, transportation, infrastructure, all those things that are formulaic happen because of funding through the amount of the census. So last week, we had reported we were at 55.6% response, and this week it's at 58.6. So we're moving in the right direction, but we really want to encourage everybody to go online, make sure, if they haven't done so yet, fill out the www.2020census.gov to complete your census. Or you can call 844-330-2020, and language services are available in multiple languages. We also, last week, and we talked about this, we have an election coming up. We want people to participate in the democratic process and vote for the people that they want to have represent them in Harrisburg and in Washington. As of now, we've had over 114,000 mail-in ballot applications, with over 72,000 that have already been processed. We're working 2 shifts now at the election department to make sure those are happening. In the next week or so, we'll be mailing out everybody who has not applied right now an application with the self-addressed stamped envelope coming back to the election department. But you don't have to wait that long. If you want to get yours a little quicker, you can do that right now by visiting AlleghenyVotes.com. You can submit your application online. You'll get yours a little bit quicker than other folks. You'll still get the self-addressed stamp envelope, and you'll have all of that gotten to you so that you can turn that around and make sure that you can vote. We want as many people to vote by mail as we can because we want to keep people safe. We know what's happened in other places. Certainly in Wisconsin, they've had a number of folks who have come down with the coronavirus, with COVID-19, and it's because of going in voting and the poll workers as well. So we want to make sure we keep people safe. Finally, again, we say this, but we can't say this enough. We want to thank all of those who are on the front lines, who are caring for the people who have COVID-19, but also our first responders, grocery clerks, food service workers, everyone else that's in the essential businesses for the work that you're doing to keep us healthy and keep us moving along during this very difficult time. I also want to thank our county employees in the leadership in the various departments for what they've been doing for the last 7 or 8 weeks. They have really stepped up in serving the public. I couldn't be more proud of the workers that we have. And again, I'm going to reinforce that we got to wear those masks as we open things up again. And you're working in an area, whether it's an office or retail place, wherever it might be, got to be wearing that mask when you're in contact with people. That'll help us keep those numbers low. Now let me bring up Dr. Bogan and talk about some of the things on the health, and then we'll open up for questions at that point. Dr. Bogan?
Good afternoon. So we've all been in our homes now for about 6 weeks, and people are ready to get out. We hear that. Sadly, we have lost 86 of our county residents and over 50,000 souls in the U.S. alone. And my thoughts and prayers are with all of you who have lost loved ones. Many in our community have also lost jobs. They've lost the ability to visit and celebrate with friends and families. And like many, my family missed the opportunity to celebrate our daughter's graduation from Pitt this weekend, but we appreciated the online celebration. But despite all the losses we've experienced, we've also gained things. We have gained a greater appreciation for our teachers, our healthcare workers, our first responders, our grocery store employees, and all the frontline workers for getting us through this. Like Mr. Fitzgerald said, our county employees have continued to work and to keep our county running. And thanks to them and to all of you actually in the county, we have really done an incredible job here. We have seen a pretty low case count here. And because of that, we have definitely saved lives. So thank you all for following our directions. Reopening is on most people's minds these days. The state will decide when Allegheny County and Southwest Pennsylvania can reopen. Our job is to ensure we're prepared to do so when we're given the go-ahead. So what do we need to do to reopen? Well, our numbers are encouraging and look to be in line with the state, what the state is looking for. Governor Wolf's data-driven plan for reopening sets a target goal of having no more than 50 new cases per 100,000 people over a 14-day period. Allegheny County appears to be within that threshold. For our 1.3 million population, we have to have fewer than 650 new confirmed cases over a 14-day period. So from April 10th to 23rd, which is the latest 14-day period for which we have complete data, our county has had 328 new or confirmed cases. And our infection rate, that is the percent of testing we've done, has been less than 10% consistently. So we are definitely looking good from a case data standpoint. Another criteria for reopening is adequate testing capacity. And that is really important because we have to be able to test anybody that starts to show symptoms of COVID-19 as quickly as possible to contain the virus and the spread and to identify outbreaks and clusters. And the good news is that both testing and our capacity to test have increased in our county. But we have to be prepared to do even more testing, and we need tests that are accurate and give a quick turnaround so we can respond quickly. We estimate that we now have the capacity in our county to do at least 2,000 tests per day. That is between hospitals, laboratories, commercial laboratories, pharmacy locations, and others. But we expect that this will also increase. Yet we still have locations where testing is hard to get, especially if you don't have a car. So we're working closely with our local foundations to support testing availability at our federally qualified health centers and those who serve the homeless populations. And we hope to share more about that next week. There's also been a lot of discussion in the news and elsewhere about antibody testing. So what is that? When we're exposed to a virus or a bacteria, our immune systems respond in many ways, including making antibodies to help protect us. But there are a few kinds of antibodies that develop both during and after the infection. And measuring antibodies can tell us if we have had the infection in the past, but it doesn't necessarily tell us if we are protected if we get that virus again. A special kind of antibody called the neutralizing antibodies are a specific antibody that attaches to the virus or its target, and it keeps it from entering the cell or neutralizing the infectivity of the virus. So assays to measure neutralizing antibodies may be able to tell us if we're protected from the virus in the future, but the currently available antibody testing that's being done does not check for this specific kind of antibody. Right now, antibody testing is quite limited in both quality and availability. And again, it tests really for previous exposure, but not for protection. However, like all things with coronavirus, we see improvements over time, and I'm certain that testing will continue to improve, and when it is ready, it'll become more available and more useful. Another important piece to reopening is the ability to conduct surveillance. The state's plan for reopening calls for robust case investigation and contact tracing so that we can identify potential clusters or outbreaks early and tell people to isolate or quarantine to stop the spread. In Allegheny County, we have staff trained to conduct both case investigation and contact tracing, and we're working to ensure that we have adequate staff when we reopen so we continue to do so and meet that demand. So in conclusion, I'd like to say, I know a lot of you are thinking about reopening. Golf courses, marinas, private campgrounds will reopen this week. Some construction projects are starting up. Hospitals are scheduling important but delayed procedures. And these are all really exciting signs. But we still have work to do, and to continue to reopen will take a while. We must be prepared to continue what we're doing. I know it's hard, but we can all do it together. Thank you.
The first question that we have is from KDK Radio. Is there any data available on the number of people who have recovered? And if not, will there be at some point?
So we know that lots of people have recovered from COVID-19. And we are working very hard on gathering data specifically about people who've been hospitalized and recovered. And as soon as we have that, we will share that.
This question from WTAE. CVS, Rite Aid, and other retailers said they are focusing on COVID-19 testing expansion. Access to testing continues to be an issue. A recent Harvard study said the U.S. needs to be doing 20 million tests per day to reopen the country completely. Currently, the country is conducting about 250,000 tests a day. After many weeks of testing at a steady 150,000 tests per day, testing must be increased by 80 times to meet the Harvard standard. There are claims in the community about folks still being refused testing even though they showed multiple symptoms. symptoms, excuse me. Will the county health department provide guidance for these retailers and health systems who are working to expand testing to address this problem?
Thanks for that important question. And I did address a little bit that in my talk already, but the health department, as you know, does not oversee testing in the county, but we have been working with healthcare systems and commercial labs and retailers to encourage expansion of testing, and we will continue to do that. We do provide guidance on testing, and for a long time the guidance was we should only be testing people who are both symptomatic and have risk factors. I think really starting in the last week or so, we have started to really encourage providers to test anyone with symptoms. We are not quite at the point where we can test asymptomatic individuals. Maybe in the future that will be the case, but right now it's still people are symptomatic and encouraging people to get tested who do have symptoms currently. You want to take that one?
Yeah. We do know from our friends in DHS that violence in homes tend to increase when families spend more time together, and that violence is often more frequent, more severe, and more dangerous. COVID-19 puts additional pressure on already vulnerable children, youth, and families. Whether you are a victim or a family or a friend or a family of someone who you suspect might be abused, there are resources available. I'm going to give you some numbers, and then we're going to show this later on, this slide that gives a lot of the information. If you have concerns about the well-being of a person under the age of 18, please call 412-473-2000 or 1-800-932-0313. These numbers answer 24 hours a day, 7 days a week, and these calls can be made anonymously. For domestic abuse, if you need to speak with an advocate or be connected to local services, you can contact the National Domestic Violence Hotline anytime, day or night, and that number is 1-800-799-SAFE, 1-800-799-7233. You can also log on to www.thehotline.org or text LOVE is LOVEIS to 22522 if you're unable to speak safely. For information about finding safe shelter or to be referred to the shelter, please call the Allegheny link at 1-866-730-2368. For older abuse, you have concern about somebody who's an elderly person over the age of 60, we would ask you to call 412-350-6905 or 1-800-344-4319. Those answer again 24 hours a day, 7 days a week. The victim may not be able to pick up the phone and call somebody for help because the abuser's in the home or in the room with them. So residents of Allegheny County also have the ability to text to 911 in situations where it is unsafe. And again, we're going to show these numbers at the end of this, at the end of the talk today, so that we'll get those numbers out to people if they do have any information. But it is a concern during this pandemic. There's often other things that happen, and domestic violence, unfortunately, is one of those things that we are concerned about.
This question is from WESA. Today, the county announced 38 new cases. How many of those are related to the outbreak at the county jail?
I'm afraid I don't have that number right on the tip of my tongue. I'm sorry.
Yeah, let me just give some jail information. And the one good thing I will say this about the Allegheny County Jail, I think we're the only jail that's putting this information out there. So the transparency that they're showing there compared to what's happening in other counties around the state has really been much more different. Some jail information. The jail today has a population of 1,711 inmates. As from March 16th, when the pandemic began, over 1,150 inmates have been released, and that's a tremendous amount of work from Judge Clark, the courts, the public defender, the district attorney, pretrial services, et cetera, all working together to make that happen. As of now, 44 inmates have been tested, 24 with COVID and 1 pending. Of those, 3 have recovered. 20 are still being treated at the Allegheny County Jail. There have been no deaths, no hospitalizations. 35 staff have been tested, 3 with COVID and 4 pending. And along those lines, mitigations that have taken place early on: no visitor policy, social, professional, or legal. Recreation time limited to 10 inmates at a time. Active screening for fever and respiratory symptoms. Fever checks as staff enter and leave the building. Monitoring staff for cough and sore throat. Additional cleaning, cleaning products have been provided. Meetings on each pod, educational materials have been posted. Increased emphasis on hand washing and hygiene. And all inmates and employees are provided with masks.
This question is from the Lake Henry Post. If restrictions are lifted in May for Allegheny County, will large-scale events like the Pittsburgh Regatta and others still go on as expected?
My sense at this time the answer to that would be no. We've seen an awful lot of events that we typically have in this region that have already been canceled. We know this weekend would be the marathon that has been canceled. The Three Rivers Arts Festival, which will be coming up a few weeks after that, has already been canceled. As Dr. Bogan talked about in her family, the graduations of our universities are being done virtually. So I think some of these larger scale events, which we all love in this region, we love the festivals and coming together and really enjoying, the communities that we have. Many of those are going to be put off this year. The Deutschtown Music Festival, which is later in the summer, has already been canceled. So you're going to see many, many more of these things that will occur this summer, and it will have to remains to be seen. But I can't imagine that we are going to have any kind of gatherings in which large amounts of folks are going to be together in close proximity. But stay tuned. Those things could possibly change as medical technology moves forward.
This question is from the Post-Gazette. The county continues to see around 20 or so new positive cases each day, and sometimes more over the last 3 weeks. With all the social distancing and lockdown requirements, has the county studied who the people are with these new positive cases? Are they just in nursing homes? Are they first responders, essential workers? Or is there some evidence that people are getting infected from, say, going to the grocery store or taking a walk?
That is a really great and important question, and I truthfully don't have the answer to that right now. I do think that some of it is unfortunately in our nursing homes, and I can investigate that a little further. Really interesting question.
This question is from the Pittsburgh Business Times. What do you think the timeline will be for Allegheny County and southwestern Pennsylvania to reopen?
Well, that remains to be seen, and I think you're starting to see some of the regions around the Commonwealth who have said very, very good numbers, particularly in the middle of the state in the northern tier, where they've really, as good as our numbers are here in the Southwest, that have seen even lower numbers in some of those areas. So I think, from what I understand, the state's going to be and the governor are going to be making some announcements later this week to lay out some of those timelines. I think those timelines will always be if the testing stays low. I think that's always going to be the case, as the numbers will determine what is open and how far things will be open. The other thing that will occur, as I mentioned, just because we open things up doesn't mean we can stop the mitigation practices that so many in this region have done so well. I mean, I just can't tell you the work that everybody has put in has kept those numbers low. And that's got to continue if we want to open things up, if we want to open up our economy, have people working. And I know for so many people that's a concern. I mean, we're here talking about health, but this is also an economic crisis that this country, the state, and the region are going through as well. So I think as the governor looks at these numbers, and Dr. Bogan talked about the various factors. It's not just the testing, it's the amount of hospitalization that's out there, it's the amount of testing and capability and contact tracing and other things that are all as part of that determinative factor that Secretary Levine and Governor Wolf will go through as they open things up.
This question from the Tribune Review: with a small but significant uptick in cases within the Allegheny County Jail, is the county considering mass testing within the jail as Montgomery County did in its county jail?
I guess that's something they'll consider. What the county has been continuing to do is follow the CDC guidelines. I believe Montgomery is the only county in the state that's doing that. The other 66 counties are following other guidelines. We certainly know in Montgomery County that they've had about 4 times as many cases as Allegheny has, and it's a county that's smaller in population than Allegheny County is. They've also had about 4 times the amount of fatalities, deaths over COVID-19 that Allegheny has as well. And that's with about the same amount of testing. I think they've tested about 16,000. Allegheny's around 15,000. So it's a different scenario, and I think the jail and the warden and the health department will continue to monitor and use best practices that the CDC and the Department of State, the State Department of Health will recommend.
This question is from WTAE, but also similar questions from WESA related to contact tracing. California plans to build an army of approximately 10,000 people that can trace the trail of coronavirus exposure. As we move forward for the reopening phase, contact tracing is considered an essential tool to help contain the virus. What is Allegheny County's plan for contact tracing? Does the health department have a set number of contact tracing staff it believes it will need to hire? And how many contact tracers have been hired or are being used so far?
So contact tracing is really an essential component of our work going forward. And again, that's to be prepared, we need to be ready to do that. So yes, we're working on a plan. We have working on worst case scenarios, best case scenarios, and that number will largely depend on the number of new cases we see. So again, we're doing some contingency planning based on worst case, best case scenarios. We currently have a core group of case investigators and contact tracers, and we are working on strategies to bring in more as needed, including employing volunteers over time. So stay tuned. We will unveil that plan as it becomes more clear what our needs are.
This question from the Post-Gazette: is there something we are not doing that we need to be doing to get to 0 cases?
These are such great questions today. I would love to see us get to 0 cases. Unfortunately, I don't think that's a realistic goal right now. Again, as we start opening up, I expect our cases will increase, which is why we have to be really ready to ask people to stay home if they're sick, again, wearing masks out there. I think the only thing that we really that we're prepared to do already is really to increase the amount of I share the hope that we'll have 0 cases soon.
This question is from the Tribune Review. Dr. Bogan said last week that the number of people tested was decreasing, and we didn't know why. Testing is happening at sufficient levels to make, didn't know why, period. Is testing happening at sufficient levels to make decisions about reopening?
Yeah, so last week I did report that our numbers were going down a bit, but I think part of it was that there was some delay in getting testing entered into the system. And when we went back and looked, the testing really hadn't declined that much. And it's back up. We are testing more. And I've spoken to all the places that are doing testing and have availability. So there is availability and capacity in our community as it's needed. And so our numbers are back up to where they were in the 400 to 500 range for most days. Again, I suspect that those numbers will increase as we reopen.
And finally, this question from the Post-Gazette: with more cases among both residents and staff at Glen Hazel, does the county know why there have been so many there and not at the other 3 Kane facilities?
I really don't have a good answer for that at this point. So no, I don't have a comment to make on that.
Well, thank you. And again, we'll do these weekly briefings. Dr. Bogan giving a lot of good information, and obviously not just once a week, but the information will continue to be pushed out. The 11 o'clock update with the numbers. any other things that come out through Allegheny alerts and other ways to stay on the coronavirus website that the county has. We just want to continue to stay vigilant on what we're doing. We've got to continue to support each other, encourage each other, and make sure that we continue to keep lowering that curve so that it goes down. That'd be a great goal if we could get to zero. It might not be realistic, but we ought to keep shooting to get it as close as we can to keep as many people healthy and to be able to open up and get back to somewhat of a normal operation that we've had in this region. So as the weather warms up and people get out and get outside and want to recreate and want to do some things to not be inside as much, we want to continue to follow the guidance of our medical professionals. We're so lucky that we have them here in southwestern Pennsylvania, the great eds and meds that we always brag about and we really have relied on during this time. So thank you all, and we'll talk to you soon.
For members of the media on the call, if there's other items that we need to follow up with or provide to you, we will do so after this call. Thank you.